Artificial Intelligence Doctor www.abcpharma.net/English. What does a BNP level of 74 pg per milliliter indicate about the patient's cardiac health? How does this level compare to the normal reference range? Cohere AI. A BNP level of 74 pg per milliliter offers valuable insights into the patient's cardiac health. Let's delve into what this level indicates and how it relates to the normal reference range. BNP, or B-type natriuretic peptide, is a hormone produced primarily by the heart's ventricles in response to distress or damage. It's often measured as an indicator of heart failure and cardiac stress. The normal reference range for BNP levels varies based on the laboratory and assay used but generally falls between 0 to 100 pg per milliliter. In the context of this information, a BNP level of 74 pg per milliliter near normal levels, this level is relatively close to the upper limit of the normal reference range. It suggests that the patient's cardiac health is generally within a normal range. The heart is not experiencing acute distress or significant structural damage. Mild cardiac stress. While BNP levels can fluctuate based on various factors, a level of 74 pg per milliliter indicates a mild degree of cardiac stress or strain. It might suggest some underlying cardiac condition, but it's not indicative of severe or advanced heart failure. Compensated heart function. The patient's heart appears to be compensating well for any existing cardiac abnormalities. This compensation might involve increased ventricular wall thickness or enhanced contractility, which helps maintain adequate cardiac output. Need for further evaluation. While the BNP level is not alarmingly high, it does warrant further evaluation. A level at the higher end of the reference range could indicate subclinical heart issues or a propensity for developing cardiac problems over time. To gain a comprehensive understanding, interpreting the BNP level alongside other clinical findings, such as echocardiogram results, vital signs, and symptoms, is crucial. BNP is one of many tools in the diagnostic arsenal, and its value lies in conjunction with other assessments to paint a clearer picture of the patient's cardiac health. GPT-4. B-type natriuretic peptide, BNP, is a hormone produced by your heart's ventricles in response to excessive stretching of heart muscle cells, myocytes. It is a biomarker used to diagnose and assess the severity of heart failure. BNP levels can vary based on age, gender, and laboratory methods, but in general, a reference range is often provided to help interpret the results. A BNP level of 74 pg per milliliter indicates that the patient is likely not in acute heart failure, as levels below 100 pg per milliliter are generally considered to be within the normal range or indicative of a low risk of heart failure. However, this level can be on the higher end of normal or slightly elevated depending on the specific reference range used by the laboratory and patient-specific factors. It's important to consider BNP levels in the context of other clinical findings, symptoms, and diagnostic tests when evaluating a patient's cardiac health. Normal range ***. Many laboratories consider BNP levels below 100 pg per milliliter as normal or not indicative of acute heart failure. Levels between 100 pg per milliliter and 400 pg per milliliter are often seen in a gray zone, where heart failure is possible but not definitive, and levels above 400 pg per milliliter are more strongly suggestive of heart failure. Elevated levels BNP levels can be elevated in conditions other than heart failure, such as renal failure, acute coronary syndromes, pulmonary embolism, and more. Age and gender factors Reference ranges can also vary based on the patient's age and gender, with older patients and women typically having slightly higher normal values. A BNP level of 74 pg per milliliter, if considered within normal limits, suggests that the patient may not currently be experiencing significant heart failure. This value could be reassuring, especially in patients with symptoms such as shortness of breath or edema, where distinguishing respiratory and other causes from heart failure is clinically important. However, it's crucial to integrate this lab value with the complete clinical picture, including symptoms, physical examination findings, and other diagnostic tests like echocardiography, to make a comprehensive assessment of the patient's cardiac health. In patients with known heart conditions or those at risk for heart disease, even normal BNP levels do not exclude the need for ongoing monitoring and management of the cardiovascular risk factors. Claude. AB-type natriuretic peptide, BNP, level of 74 pg per milliliter suggests that the patient's cardiac health may be mildly compromised, although it does not definitively indicate the presence of heart failure. This level falls within the gray zone and should be interpreted in the context of the patient's clinical presentation and other diagnostic findings. Compared to the normal reference range, a BNP level of 74 pg per milliliter is mildly elevated. 1. Normal BNP levels. In healthy individuals, BNP levels are typically less than 50 pg per milliliter. Some laboratories may use a lower cutoff, such as less than 35 pg per milliliter, for ruling out heart failure in patients with acute dyspnea. 2. Gray zone BNP levels. BNP levels between 50,100 pg per milliliter, or 35,100 pg per milliliter, depending on the laboratory, are considered in the gray zone. Patients with BNP levels in this range may have early or mild heart failure, but other factors such as age, renal function, and comorbidity should be considered. A BNP level of 74 pg per milliliter, being in the gray zone, may indicate the presence of early or mild cardiac dysfunction, such as mild left ventricular systolic or diastolic dysfunction, early stages of heart failure, compensated heart failure with minimal symptoms. However, it is essential to consider other factors that can contribute to mildly elevated BNP levels, such as advanced age, renal dysfunction, atrial fibrillation, valvular heart disease, pulmonary hypertension, obesity, acute coronary syndrome. Therefore, a BNP level of 74 pg per milliliter should be interpreted in conjunction with the patient's clinical history, physical examination findings, echocardiography results, and other relevant cardiovascular risk factors. In summary, a BNP level of 74 pg per milliliter is mildly elevated compared to the normal reference range and may indicate early or mild cardiac dysfunction. Serial BNP measurements and close monitoring of the patient's clinical status are essential for the optimal management of individuals with mildly elevated BNP levels.